Good morning, Bucks County. This is Diane Marseglia, Bucks County Chairperson of the Commissioners. I am joined with Commissioner Harvey and Commissioner DiGirolamo. I think we each wanted to make a statement or just say something this morning before we started to answer some of the questions that you've submitted, and you can submit them through the email that is there on Facebook. What I wanted to say is if you grew up around my age, and I am 60, you probably share some of the same memories I have. And my first real awareness of racism and bigotry came in explanations of why people were rioting across the river in Trenton and Philadelphia and Newark shortly after Martin Luther King and Robert Kennedy died. And I also grew up as one who's about 60 in a time when we had a chronic fear of nuclear war and that there'd be radiation and people would be having sickness and all around us. Those two fears truly influenced my career choice as a social worker and in politics. In the past 3 months, I have watched those memories and that fear be revisited, first with COVID-19 and now with the sad and brutal loss of George Floyd and the pain that has resurfaced for many. I want you to know that I am grateful for the grace of the Bucks County residents and that you have worked to journey through this part of the pandemic with us. And I remind you that you need to stay in your safety lanes because this pandemic is not over. And I am sorry for the pain that many residents are feeling right now for the losses they have experienced during this pandemic. I am also grateful for the grace of Bucks County residents for speaking in words about their anger about the death of Mr. Floyd. I am sorry for the pain that so many Bucks Countyans carry for the suffering that they, their family, and their friends have felt for way too many years. But we cannot keep ourselves or our fellow man safe if we are caustic and selfish and foolish and we refuse to wear our masks or maintain social distance. And we cannot keep our fellow man safe if we do not stand up against bigotry and racism. And none of us have ever kept anyone safe by engaging in any form of violence. We are our brother's keeper, and I pray and hope that we will continue to do that in Bucks County. And I will then pass this off to Commissioner Harvey and then Commissioner DiGirolamo, and then we'll take questions.
Thank you, Diane. I think it was beautifully stated. In the early 1900s, an author named W.E.B. Du Bois who predicted the problem in America. The biggest problem in the 20th century in America would be the problem of the color line. He made that prediction, as I said, in I think 1901, 1902 time period, 1903 maybe. I thought it was sort of interesting that he was able to accurately predict that throughout the 20th century, the issue of racism and the divide between the races in this country would be a defining moment, defining characteristic. Sadly, it continues into the first 2 decades of the 21st century. And the murder of Mr. Floyd is really just the latest example of that gap. We know that racism has increased over the past decade in this country. We know there's active attempts by the Ku Klux Klan to recruit people here in Bucks County and in neighboring Montgomery County just in the past couple of years. The violence that's taken place against people of different races, different ethnic groups, different creeds, is one of the most fundamentally un-American things that we see happening. The way we combat it is by being truly American, by treating everybody equally, by making sure that we're fighting to make sure opportunity is guaranteed to all. What you do with that opportunity is obviously your choice. We've been very, very strong over the past couple of months fighting through this pandemic, this once in a century pandemic. We need to keep using that strength to push forward and make America truly the place it was meant to be. So I'm confident we can do that. We did have some random acts of vandalism in a few areas in Bucks County yesterday, but we did have protests in Bucks County that were carried out peacefully. And that was true all over the country, that there were peaceful protests in cities and locations all across America. Protesters kneeling with police officers, with elected officials, praying that our country can overcome these problems. And if we work together, we can do that, just as we can work together to defeat this virus and pick our country back up again. I'm confident we will be able to do that, and I know that the police officers here in Bucks County, the politicians, the leaders of faith, the activists are all wanting to work to make sure that we're a leader in that fight to make America truly the land of promise it should be for people, regardless of whatever differences you may see between us. So, Commissioner DiGirolamo?
Yes, good morning, everyone. Good to be with you. Thank you for joining us today. And, along with my colleagues, certainly the events that led up to the death of George Floyd in Minneapolis last week were heartbreaking. I mean, tragic. And the video of his death was absolutely shocking. And I think as Americans, we all have a right to express our opinion and to protest in a peaceful way. And the images of the violence that's going on now and the looting and crimes by a small number of people really have no place. And in America, I've always found that we get things done and we change things when we work together and come together. And I think that's what this country of ours needs to do right away, for all of us to come together and work together. And that's how we get things done. And that's how change occurs. And, I think also a good example of that, how working together, and again, is the way that we have worked together to address this pandemic, the COVID-19, the virus. And I especially look at how we've come together here in Bucks County to fight this. And the good news about what we've been doing is that our numbers are down. We've done a good job of managing it. The people in Bucks County have come together and they've maintained the social distancing. Everyone, for the most part, is wearing masks when they go out. And that has all really, really been helpful. And also the good work of our police, our emergency management people, our Department of Health, that has gone a long way to keep these numbers down. And Bucks County is in a really good position. And maybe some of the questions will come up. We are about ready to move into the yellow phase on Friday, June the 5th. And that is good news for the people of Bucks County and good news for a lot of the business community as well. So again, good to be with you. And we are ready, willing, and able to take any questions that come our way. Thank you.
Thanks, everybody. So let's go. The first question that we have here, and this is from Chris Hopkins of Jamison. He's very concerned about the integrity of the data being used to determine the spread of COVID-19. He's aware of two specific examples where the COVID-19 data was skewed to meet other guidelines. One time it had to do with a relative's death that was slated as COVID when she did not die of that at all in order for additional Medicaid funds to be given. And the other instance when friends were told that they should fake COVID-19 symptoms so that they would be able to go and get tested and then they'd be able to visit their grandchild. They want to know what we could do about the integrity of the data and how concerned am I about that? Well, I guess a couple things. First of all, going backwards in terms of the people being checked in order to be able to see their newborn grandchild. I don't think that affects the data. If they were found to be negative, then that's fine. They're negative. It doesn't really matter either way. The one thing I would say is on their way to visit the grandchild, if they stop for gas or stop at a store, they could very well have picked up that virus. So that doesn't really affect the data. In the other situation, I think, and long-term, we will find out if indeed there were any people that, or nursing homes or long-term care or hospitals that fudged numbers and said people died from COVID-19 in order to get increased Medicare funds. But I have heard that that's been debunked and as not true. I know we would never have done that in our nursing home, but I'm sure that in the coming years after this crisis, we'll hear more. I'll pass that off to Commissioner Harvey and see if he has an answer to that.
Yeah, I think your answer to the question about faking symptoms to get a test, I mean, it's one of the things that we've been trying to get doctors to change a little bit of their procedures early on when there really was a critical shortage of tests and we didn't know as much about the virus. We were really encouraging people to get a test only if they had symptoms or if they knew that they had been exposed to somebody who had been confirmed to be a coronavirus patient. Now that the testing has become a little bit more available, especially through a lot of private agencies, CVS's and urgent cares, we have been encouraging doctors to allow people to get tests even if they don't have symptoms. The statistic I saw, the most recent one, which I believe is accurate, is about a third of the people who have been found to have coronavirus never really had any symptoms. So, hopefully we can get more testing that way so that you can have it no matter what your condition is or what the situation is. In terms of people being, and we've been hearing this from the beginning really about, how do we determine if someone died of coronavirus or didn't die from coronavirus? The coronavirus, as we know, puts a lot of stress on the respiratory system. And for people who are battling other severe illnesses, that added stress on the respiratory system may hasten their death. So yes, they may have some kind of serious health issue. They may have cancer. They may have other lung issues. And they may be people who might pass away in the next day or two or a week or a month. Did the coronavirus cause their death to happen a little bit sooner? Maybe, yes. I think the opposite is sometimes true in terms of reporting statistics, that if you had somebody who passed away and had coronavirus and you didn't have it included on their death certificate, we'd have questions from people wondering why we're trying to hide or accusing us of hiding or accusing hospitals or other states or nursing facilities of trying to hide the fact that people had coronavirus. So I think certainly the doctors and coroners and everybody's in a tough spot trying to just report what the facts are. Person passed away. Did they have coronavirus? Yes. Was it a contributing factor? Possibly. But so I think the numbers are probably skewed in either direction to the point where it's going to be a wash in the end.
Yeah, just a little bit. I mean, I can assure everybody that our Department of Health and Dr. Damsker does everything he possibly can to make sure that the numbers and statistics that he gives out, not only to the public, but also to the Department of Health up in Harrisburg, are as accurate as they can possibly be. And Dr. Damsker has done a terrific job. And, as far as that one part about the Medicaid fraud and a relative death who did not die from COVID, they marked it down as dying from COVID to collect more Medicaid funds. I mean, I have a hard time understanding how they would be able to collect more Medicaid funds, but if they did, that would certainly be a federal crime. And, people are really putting themselves in danger if that's absolutely Medicaid fraud and a federal crime. And if anybody wants to take a chance of doing that, I can't imagine why someone would do that. And because if they get caught, they'd be in a lot of trouble. But again, our Department of Health and the County of Bucks have done everything we possibly can to make sure that the numbers and statistics that we've been given out are as accurate as they can possibly be. Thanks, Diane.
Thank you. The next question is from Allison Landis of Warrington. Can you please explain the differences in numbers that the state is reporting for Bucks County versus what the county is reporting? For instance, at 12 o'clock on May 29th, the Pennsylvania Department of Health said that we had 5,012 confirmed cases, but at 10:26 on the same day, the county reported only 4,754 cases, and that's a difference of 258. So it appears that it would be pretty significant. And I'll let my colleagues address this a little bit, but I just wanted to get off something else that was on my mind about the previous question. And that had to do with testing. And I just wanted to say that there's ample testing out there. And for those people who want to be tested and aren't having symptoms and you can't get your doctor to do it, there are several CVS and Rite Aids in Bucks County for which you do not need to have a prescription. So you can go and get a test. So there is ample testing here. So Commissioner Harvey, do you want to address Ms. Landis's question about Bucks County versus Department of Health numbers and then pass it to Jean?
Yeah, we've seen this question come up a couple times in the past, and we've talked a lot with Dr. Damsker, our health department director, and right from the beginning, early in March, when we first started to see cases, there were a lot of changes in numbers simply because one of the people who was an early case here in Bucks County was someone whose address was in Bucks, but they weren't living in Bucks County at the time when they were tested, and even when they were tested positive, they never came back to Bucks County. So for a while they were listed as a Bucks County case because their address was still Bucks County, but they weren't actually in Bucks County. And so after a few days, the number, that case was sort of given away to the place where they were living and, at the time. That's been true really throughout. We are, because of our contact tracing that we're doing, about 96% of the cases here in Bucks are contacted by our health department. We are doing a very, very good job of sorting through some of that problematic, information. We have people in some cases, again, who have a Bucks residency. They may be going to college in another state. They may have moved to another state. They could be visiting relatives, and then the quarantines happened, and they were there at the time. We have people who they may be Bucks County residents, but they're taken to a Philadelphia hospital, or they're Philadelphia residents and they're coming to Bucks County hospitals, and maybe they pass away in a Bucks County hospital. And so now that might be a death that's attributed to Bucks County, but it's a Philadelphia resident who maybe got the virus in Philadelphia, and vice versa. So the numbers are difficult sometimes when you have the cross-border situation. The numbers that Bucks County, our health department is reporting, are the ones that we focus the most on.
And I think Commissioner Harvey explained it very, very well. And again, I'll just go back to what he said at the beginning. I mean, I know Dr. Damsker does everything he can possibly do to make sure the numbers that he puts out are good and legitimate. So, there are reasons why, although 258 cases out of about 5,000, that does seem to be like an awful lot. So, but there are reasons why there should be a little bit of a discrepancy.
Thanks. I'm going to read the next question, make a brief comment. I'm going to go to Jean then to answer it. It has to do with playgrounds, but then Bob, if you could answer any questions specific to Falls Township. And the question is, are all of the Bucks County playgrounds opened like they are in surrounding counties? And then there were several questions about playgrounds and pavilions in Falls Township. But Bucks County may be has its playgrounds accessible in county parks, but I can't speak to municipalities. Municipalities have their own choices that they can make, but we have issued some recommendations on how they could be opened. Commissioner DiGirolamo?
Yeah, I mean, I think the local playgrounds, I mean, again, I think it's up to the municipalities whether they're going to open them or not. And I know Dr. Damsker from the Department of Health has put out some guidelines for them to follow. And again, always dealing with health and safety for our residents. And he put the guidelines out. And from my understanding is that most of the municipalities, if not all of them, are going to be opening up their playgrounds on Friday, June 5th, when we enter into the yellow phase. And I absolutely think it's the right thing to do. And people can make a decision whether or not they want to go there. But again, there's also guidelines and restrictions that have been put out to make sure that they're open as safely as possible for our residents and for our children. Bob?
Yeah, Yes, Commissioner DiGirolamo said, and Commissioner Marseglia, the playgrounds, whether they're on school property or township or borough property, those entities, the school districts, the boroughs, the townships, they're the ones who control those facilities, just like they have control of their own parks, and we have control of the county parks. We have, as Commissioner Marseglia said, we made some recommendations. I know there's been some recent kind of back and forth about how easy it is to catch the virus off of a surface instead of just face to face. We still have confirmed we have cases in Bucks County. We've had cases in Bucks County that are confirmed people who got them from some kind of a surface. So it is possible to get it. I think what the CDC said a few weeks ago was that it's not as easy to get it as they thought it was originally, but it doesn't mean you can't get it. And that's one of the things that we've been communicating to local governments is that while you can choose to open parks, there should be clear signage about mask wearing. There should be clear signage about hand sanitizer for you and your children when they're using the playground, before they use it, after they use it. With masks, obviously small children, people who have illnesses don't necessarily have to wear masks. But I'm thinking about when my kids were little and I didn't just sort of let them on the playground if they're doing the monkey bars. I was kind of holding them while they were sort of climbing across. And so the adults could be very, very kind of close interaction with other kids who happen to be using the playground equipment. So that's one of the things to consider while you're doing it. In terms of Falls Township specifically, I believe their plan is to open them on Friday when we go to yellow.
Okay, thank you. I'm going to combine like 3 questions here so everybody can kind of like ask the part they want. So I'll read all 3 of them. The first one is from Cheryl Schaefer, and she's asking what our plans are for the inevitable COVID surge due to all these protests. And the second thing is Kim Broderick Sweeney, who said, who thought it was a good idea to allow a protest on election day that ends at a police station polling place in Warminster? And then just to add the third, that this is from Howard Shargle. He says, there's a protest planned for today in Doylestown. Will you be enforcing social distancing since we are still red, and ensuring contact tracing information is collected to track what is probably going to be an outbreak? Or is there a concern of community spread? I will pass this on to each commissioner to respond to what they want. I will respond to that last question from Howard about Doylestown. So this is a Commonwealth, and therefore it is the municipality or borough's decision on what can happen, not the county. We know that we have talked to the borough, and we know that the people who are doing the protest have also talked to the borough. They've talked to Central Bucks Police. So there is a communication going on. We have shared with the people organizing that protest the importance of the 6-foot distance and the masking. And I would say generally the protests that have been peaceful that I have seen and heard about have all had people wearing masks and staying generally within 6 feet apart. Those don't seem to be the problem. It's some of the other ones that are a problem. Commissioner Harvey?
Yeah, thank you. I think you stated it very well. Regarding the protest here in Doylestown. In terms of, I'm not actually aware of a protest in Warminster scheduled for tomorrow. I'm not sure. That's the first I'm hearing about a protest in Warminster. Again, as Commissioner Marseglia said, if you're going to do some kind of a march, a protest, something of that nature in a specific municipality, it's that specific municipality that would authorize that. It wouldn't be the county. So the Warminster Township government would be the ones to sort of reach out to about that. In terms of handling any kind of surge in cases, certainly we are much better prepared now than we would have been a few months ago. We know from our hospital data that we have a lot of availability there. We have a lot more testing in place now than we did before. We would certainly hope that by this point, there really is no excuse for not knowing about all the measures you have to take to maintain safety with social distancing and masking. So that shouldn't be an issue either. Commissioner DiGirolamo?
Just to add, I did not hear of a protest in Warminster either on election day. I can only probably take a guess of, what it would be at. And, I know there's a little bit of a small amount of controversy about wearing masks and going to vote. And, I just want to let everybody know and encourage people that we're wearing masks not so much to protect ourselves, although it does afford us a little bit of protection, but we're really wearing masks to protect other people that we're around, whether we're going to the supermarket or going to a store or wherever we're at in public. We're wearing the mask to protect our fellow citizens. And on election day, I mean, we have people, and really great people, who are working the polls on election day. And most of them are spending the whole day there from 7 o'clock in the morning till 8 o'clock at night, and 13 hours. And it's a long day. And wearing masks to go in and vote not only helps protect our poll workers, but protects the other people who are there and are voting. So I would just encourage everybody to please wear a mask on election day when you go to vote. I mean, I know there were other ways to vote. If you were concerned about going to vote, you could have voted by mail, you could vote absentee. So, but please consider and please do wear a mask when you go to vote. We will have them available at the polls for somebody that shows up that maybe forgot to bring the mask with them. So there will be a mask there for you to use. But really important for the safety of not only the poll workers, but the other voters, for everyone to wear a mask when they go and vote on election day tomorrow.
Thanks, everybody. So the next question is from Amy Laura, who said, "Thank you very much for all you're doing." She's a nurse in Tullytown. "Thank you for your service," and would like us to talk about two different things. Could we please put some guidance out for the public with the proper way of wearing a mask? It's very concerning for her. And if the protests continue, it could increase our numbers for opening up. And is the opening up day guaranteed for Friday? I'll just take a stab at two things. First of all, if you're wearing a mask, I believe that the idea is it should fit snugly across your nose and mouth. I know I have heard a lot of people complaining that people are covering their mouth with the mask, but not covering their nose with the mask. So it's supposed to cover both. The other thing about opening up for Friday, one good thing about the protesters, this is not a perfect answer, but they are outdoors. So that does also help a little bit in terms of spreading, it's not spreading the coronavirus. Commissioner Harvey?
Yeah, on the buckscounty.org website, if you take a look at the COVID-19 page, you'll see there's actually another button for economic resources. And one of the things we've done there is we've put some information about PPE, and including a couple of videos about proper way to put on and take off an N95 mask, proper ways to make a mask, a homemade mask, and also information about cross-contamination, real short videos. So we put that out there for people to get the information spread. We do have, let's see, I was actually jumping ahead to another question, but in terms of Friday, again, we feel very good and with our numbers going the way they're going. We do think that we'll be in yellow on Friday, and I know I see a couple of questions coming up about guidance for businesses. Again, going back to the website, the economic recovery task force that we formed put together a lot of information and helped the county develop information and guidance that is up on that COVID-19 page. Going to buckscounty.org, you'll see about preparing for yellow. There's guidance for businesses. There's guidance from the state. There's local guidance available from the Bucks County. There's federal guidance there. So we try to make it as accessible as we can. Just a matter of going and taking a look at that site, and we're going to be changing that and updating it as we need to. As new guidance comes out, we make updates to make it as real time as we can.
And just a quick comment, especially to Amy, and I heard that you were a nurse, Amy, so I want to thank you for the good work that you're doing through this pandemic and the virus. I have a daughter who also works at one of our local hospitals, so we talk a lot about what's going on at the hospital, and everybody who's working at the hospital or anywhere in healthcare. I just want to thank all of you here in Bucks County for the good work that you're doing and the life-saving work that you're doing. And you know, you're working under a certain amount of enhanced risk when you go to work. So, you know, we very, very much appreciate everything that you're doing to keep our people here in Bucks County safe and sound.
Thank you. Thanks. So our next question is, and it's a very good one, it's from Megan Brock, and she's asking, do we know the impact the lockdown has had on suicide, overdoses, and abuse? You know, as a clinical social worker, this is the thing I've been worrying about the most. It's the main reason that I am glad that we are moving to yellow so soon, because I think this does take a toll on people. The thing that I have personally been worried about the most is just the children not being in school. So when they're not in school, you know, that creates an extra stress at home, especially if parents are under financial stress at this time. And the schools where, you know, kids sometimes are able to report difficulties they're having so that we're able to reach out. It doesn't even have to be abuse. It can be, you know, a mental health issue, neglect, anything. We are so reliant on our teachers and our schools to get us information. And with the kids not in there from March all the way till September, it's really pretty concerning. Our social workers, however, at Children and Youth are at work. So we are responding to all calls. They are going out to people's homes, and that is happening. Before passing this off to Commissioner DiGirolamo, I will say that we have not had an increase in suicides since this has happened, but we have had an increase in overdoses from where we were in the beginning of the year. And perhaps Commissioner DiGirolamo would like to take.
Yeah, I mean, this has been a big concern of mine from the very beginning, because my years working up in Harrisburg, I was actually the chairperson for the Human Services Committee up in Harrisburg. And this has been a big concern of mine, the mental health aspect of it, and also the people who have problems with addiction, whether they're drugs or alcohol. And I always say this, alcohol is still the #1 abused drug. I mean, the one thing I have heard that to me is concerning is there has been a increase in the number of domestic violence issues because people are, you know, stuck in their home. And, you know, when I talk to the police officers, it seems like almost all the time that alcohol was involved in one way, shape, or another on these domestic violence cases that the police are handling right now. But just to let everybody know that the county, we do have resources available and help is available for anybody who is struggling with suicidal thoughts, mental health issues, or addiction issues. And you can call the county, you can call our number here at the county, and there are people who are available to help, whether you have insurance or you do not have insurance, help is available. So please, if anybody is struggling right now with mental health issues or drug and alcohol issues, call our county number. And the one number is 348-6000, and somebody will direct you to the right place if you want to get there. And make sure you call. There's help available and funds available to help.
No, I can't really add too much more than what Commissioner Marseglia and Commissioner DiGirolamo said. Just in addition to that, one of the things we did very early on, and Commissioner Marseglia was very quick on this, was to make sure that the Bucks County website had links almost immediately as soon as the lockdown began to different agencies and hotlines to help people who were suffering from addiction issues or mental health issues. So that was something we jumped on very, very quickly here in Bucks County.
Yeah, this is Diane. Again, I just want to make sure I give that number out for anybody that has a problem with addiction. The county number, it's 215-444-2700. So just call that number, 215-444-2700. If you're struggling with a drug or alcohol problem or addiction, just call that number and help will be available.
We'll put that number on the chat line there, but you can also go on to our website. Everything is on there on the left-hand side as you look at it. So I'll give you plenty of time to answer this question, Commissioner Harvey. First, I'm just going to answer this one very quick. This is Jessica Griffin. She says, where is the virologist you're I think she means conversing with, to form these opinions? I don't think we're forming opinions here. Generally speaking, we're giving you facts, and these facts that we're giving you are based on what we are getting from an epidemiologist, and that is Dr. David Damsker, the director of our health department. And I will go right to Commissioner Harvey. If you would start and answer these two questions, please provide an update on the county small business grant, and also, and that is from Peter Mills. And there is another question here about restaurants in Doylestown Township, but I'm having trouble finding the name that went with it, but maybe, I don't know if you see it there, but maybe you can take a stab at those answers and we'll look for that name.
Sure. Yeah, the last Tuesday was the application deadline for the Bucks Back to Work Small Business Grant. We did have quite a few applicants who submitted applications with very minor errors, and so the decision was made to kind of reach back to them just to give them a limited chance to sort of get the information in so that we could make sure they got considered. Our goal is to try and help as many people as we can and as many businesses as we can. In fact, we're probably going to be voting on Wednesday about expanding the size of the program or already starting to think about a second round of funding. It's going to take a couple weeks to go through all of the data. The company that we've hired to do that research and to do that review is doing it as we speak. They've been doing it really since last Tuesday, gathering all the information, going through it. They have an algorithm they put everything through, and then they are going to be putting together a score for those businesses that will then be used to determine where the first round of grants does go. Keep in mind, if you've applied, you do not have to reapply if we do a second round. It's possible, depending on future rounds, that we may kind of reach back out to you to get some more up-to-date financial information, but you won't have to go through the entire application process a second time. Guidance for things like restaurants. I do see a question here about restaurants from Lisa Flamia Frick about outdoor dining services. Yeah, there is, as you know, the governor did alter the yellow phase to allow some outdoor dining. That also information is available on the Preparing for Yellow economic resources on the Bucks County website, and that's been updated, and we'll keep updating it. One of the things to keep in mind is not every borough and township has slightly different zoning rules regarding outdoor seating, and so your first point of contact should be with your local municipality to find out if you're going to be allowed to have outdoor seating, and a way to do it safely. But in terms of other information, and that's available on the website as well. And I think there was one about retail from Drew Thomas, retail in downtown Doylestown. I believe, and without have to look back, I believe it's still going to be largely. I think curbside's being sort of encouraged. The concern is about having too many people sort of inside the closed space, protecting your staff, your employees, yourself if you're working there, and also monitoring how many people are coming in and out of those facilities so that you're keeping a small number of people inside your store.
Yeah. And I thought Commissioner Harvey did a good job of explaining both issues. I think it'll be good, because I think a lot of our restaurants, our business people, our restaurants here in Bucks County are really looking forward to opening the outdoor seating on Friday. I think they're really looking forward to it, and I know that this will get a lot of people back to work in the restaurant and hospitality industry. So I think it'll be a really, really good thing. And again, the goal is to get the green. Once we're at yellow, our goal is to get the green as quickly and as safely as possible.
And as we know, the way to get to green is social distancing and masks, even when we're in yellow. We have a couple questions about the polls, and tomorrow is election day. So if you have not voted by a mail-in ballot, please be sure and get to your poll tomorrow. The first is from Deb B, and she says, what about masks at polling stations tomorrow? You cannot deny anyone the right to vote. It's illegal. How is this going to be handled? There are a lot of rumors that need to be dispelled. And Kim Jowett is asking, what about the poll workers? Do we expect them to wear masks all day? So I wish that Deb, you would tell us what some of those rumors are. And if you want to email me, I would be happy to try to dispel them. So I'm just kind of guessing at this point, but I'll take a quick stab at this question and then pass it on. You need to wear masks to the polls. We are in a pandemic. People will probably be wearing their shoes and they'll be wearing shirts and they need to wear masks. And we are expecting poll workers to wear masks. There are a few people who have medical conditions for which they will not have to wear a mask and they will bring that medical excuse with them. And we understand that. And the same with the poll workers. We have also come up with, we purchased plexiglass to separate the poll workers from those who are voting. So we are doing everything we can to make sure that the virus is not spread. Now it's incumbent on everybody to be responsible and do what we have asked to happen. We would, if necessary, someone comes without a mask, we will be providing that mask. If they would like, we can also provide them with a provisional ballot, which is similar to a write-in ballot, but we will carry it to the poll for them that night. Commissioner Harvey?
No, I think you answered it well. I mean, the concern again is for, as Commissioner DiGirolamo said, the people who are choosing to spend 13, 14 hours a day helping democracy actually function, which is what the poll workers are doing, and trying to protect them. As we've all been in the political game long enough, we spent lots of time, all three of us, around polling places for a long time, and so we know that there are the people in those polling stations work well together. They give each other breaks periodically to kind of go home, get something to eat. And so I don't think anyone wants to wear a mask for 13, 14 hours, but we trust that they're going to be able to work together so that people can get a break and go off somewhere, maybe outside, and just take the mask off for a little while and have to be able to breathe without the mask on. But I'm very confident that we'll be able to do this well.
Yep. And again, as I said a little bit earlier, that we're wearing masks to afford ourselves some protection, but we're really wearing a mask to protect the other people that we're around. So, I mean, that to me is the reasonable and sensible thing to do, to make sure you protect your fellow voters and make sure you protect our poll workers by wearing a mask when you go in to vote.
I just would make sure, see if there's any other questions about the ballots tomorrow. There is one, another one from Kim Jowett that had to do with the records for registered voters. People have moved and they have passed away, and yet they're still on the rolls as registered voters. That's not necessarily true. When someone passes away, the funeral home is obliged to tell Social Security. That usually happens within a day. Social Security lets the state know, and they let the Board of Elections know, so that person is removed from the rolls. So that has been in place for quite a while. And if you have registered to vote, you probably remember they've asked you for your address the last time you voted. Every state does that to make sure that they call the state or contact through electronic means today to remove you from the previous place that you lived. Commissioner Harvey, what did I forget about that?
Well, certainly we want to make sure that we do purge the voting rolls every so often. That's with people who haven't voted in several federal elections, and also people who've gotten a letter in the mail asking them if they want to remain a registered voter. There are multiple checks to make sure, because the last thing you want to do is to kick somebody off the voting rolls who you shouldn't be kicking off. And I remember there was a person registered at my home, a previous owner, for a little while when I first moved there. I'd see her name on the voting rolls periodically. The motor voter bill, which was passed back in the early 90s, mid 90s, actually was one of the reasons why you change your driver's license, and it should automatically change with your voter registration. And the coroner here in Bucks County also communicates with the Board of Elections whenever someone passes away.
Yep. I'm fine, Diane. I think you've answered the question pretty well.
You're muted.
Diane, I think you're on mute.
I'm thinking some people like me on mute, but this past week, Stephanie Langnier has that they have a confirmed case, I guess, or if someone has a confirmed case and they don't have an absentee ballot, what are those options for anybody who is quarantined? And I guess that's between today and tomorrow to be able to vote. There are emergency ballots, but you would have to have someone plead that to a judge. You could call the Board of Elections and they can confirm that and help you to have someone make a plea to a judge to have a ballot delivered to you. Do you know any more about how to do that in this situation? Commissioner Harvey or DiGirolamo?
I mean, I do not, but I would suggest that calling the Board of Election and running whatever the scenario is by the Board of Election, and hopefully they will have a way that you will be able to vote and come up with a scenario, because I think it's important that everybody who absolutely wants to vote has the ability to be able to vote. And so call the Board of Election, and I think that they should be able to help you out.
Thanks. Bob, anything? Okay. The next question is from Tom Rorvik. Good morning, Commissioners. Are there any plans to request the National Guard's assistance to maintain the peace at any planned protests in Bucks County in the coming days so our county doesn't sustain any further economic damage if these events get out of hand? I am hoping that that isn't going to happen. I'm hoping that we can continue the dialogue that needs to happen on these issues and people can continue to express using their words. Commissioner Harvey?
Yeah, I think it's a good opportunity just to highlight something we probably should have said earlier. I apologize for not doing it. Our emergency management coordinator, Scott Forster, worked incredibly hard over this weekend. He probably got a total of about 3 hours sleep since Friday, working with police chiefs from across the county, working with the Pennsylvania State Police, New Jersey State Police, Philadelphia, as well as Montgomery County, to make sure that we had people in place, we had our resources in place to guarantee the safety of the residents of this county as well as property in this county. We did have a few isolated instances, as we said earlier, of vandalism. The police were very quick to respond. I believe they actually did apprehend a few people in some of those cases. Nothing like what we've seen, the criminal activities that we've seen happening in some other places around the country. So really, hats off to them for all the work they put in this weekend and continue to put in. They're still, very conscious of the fact that we want to make sure that we're staying on top of things and keeping an eye on social media and making sure we're finding out, ahead of time any potential areas where you might see some protests. And we did have protests yesterday, and they went off peacefully, and we're hopeful that'll continue.
Yeah, Gene, and and again, Bob mentioned Scott Forster, and he's done a really, really good job. And over the weekend, Saturday and Sunday, we were on the phone with Scott, the commissioners, with some other people talking about, what's going on and what were the procedures in place. And there have been a few instances of protesters. I think for the most part, they've been very peaceful. There has been some acts of violence associated with the protest, but our emergency management people and our police have handled them very well. And calling in the National Guard, and hopefully we won't have to do that. But if it ever got to that point where it was something that we couldn't handle within the county with our police and emergency people, then that would certainly be an option. But as of right now, I don't think we're going to need it, because I think our police and our emergency management people have things well under control.
Great. This is from Jamie Devery. Sometimes I'm afraid I'm messing everybody's name up, so I apologize if I am. And I know and respect each of you, but honestly, a lot of people are not wearing masks or social distancing. I think people are fed up with the mixed information. My concern is what happens in a month if there's a spike? Will we end up going back into the red again? So the first thing I would say is based on the feedback I have gotten from people who email me and write to me and are saying that they've heard things about you shouldn't wear a mask. When I've looked and asked for them to send me the information where they hear it, it's all been fake. It's been debunked. You need to wear a mask. In the very, very, very beginning of this whole COVID crisis, when we knew very little bit about it, the emphasis was on not wearing a mask to save them for healthcare workers. But over time, they've discovered different things about this virus. And now we realize that you can protect yourself a little bit by having one on, and you are definitely protecting others. And the people who are the most dangerous are those who do not have symptoms. I believe it's maybe the 2 days between when you get it and you actually show symptoms, you are also very highly contagious too. So the issue is that we need to protect ourselves and protect our neighbors. Tell people who aren't wearing a mask and don't go near them. It's not appropriate. There may be some, though, that you will see that could have a medical reason for that. And I'll let Commissioner Harvey and DiGirolamo answer the part about what would happen if there's a spike, and could there be a spike? And should we even expect maybe there might be a little one? Commissioner Harvey?
Well, I think we're expecting some kind of a little spike, just because as people start going around a little bit more, they might feel more comfortable going out and getting tested. The tests are more available now, so people might get a test where they didn't want to get one before. They may find out that they actually, have gotten or did have the virus or have it currently. So that we're expecting a small spike. Obviously we hope that the spike does not get too bad. The idea of being in the red, of having people quarantined, was to protect our hospitals, to protect the staff at those and employees at those facilities, to protect those who are vulnerable among us. We have more systems in place now. We have more PPE now. The hospitals are in good shape, so that we should be able to handle small spikes. Could we go back to red? I think we'd have to see a really dramatic increase in cases in order for us to move back to red, which I don't think that's a likely thing to happen.
Yeah, I mean, it's even with opening up a little bit in this yellow phase, I am really confident in our Department of Health and the job that they've been doing, especially as been mentioned before with this contact tracing. So I am hopeful that there will not be a big spike. There might be a little one. I am really optimistic that we won't even have a little spike, because I think our Department of Health is doing such a terrific job in identifying and testing and the contact tracing. I think we're in good shape here in Bucks County to handle opening up to a yellow phase. And I'm very confident that there hopefully won't be a spike. I really am. I'm very confident in the people that we have working here in Bucks County.
Thanks. I'm going to combine these two questions. The first one is from Jennifer Herring, and she is saying, what should people do if their mail-in ballot didn't get recorded as received by the Board of Elections in time? Should they vote by a provisional ballot at the polling location? And I'll add to that, Vincent Mariana has asked us to please clarify the process for a provisional ballot and what they actually are and how are they counted. That people in the comments are concerned about that they are not counted, should they be counted properly. I'm going to start just with that part and then I'll pass it on. These provisional ballots, when they are received at the Board of Elections, they are opened by the staff of the Board of Elections, and they are put onto an Excel spreadsheet type of thing. And then the Board of Elections actually and that is comprised of right now 2 commissioners, Commissioner DiGirolamo and I, as well as Judge McGuffin, who was on the Board of Elections. And then we sit in a meeting, it's an open meeting, and they kind of review the provisional ballot and determine whether or not it should be cast or not. In the case of people who cast a provisional ballot because they don't want to wear a mask or they're not sure about their ballot being in, that's not so much a discussion we would have to have. It's more about if somebody were to vote in a polling place and they think that's their poll, but it's really somewhere else. Sometimes we have to sit and look at the provisional ballot and determine like if partially their ballot can be counted or if maybe it can't at all. They might think they were registered to vote, say in Yardley, but really they're registered to vote still where they lived in Delaware. So we try to marry those things together. maybe Bob and Jean can tackle more the part about how to get a provisional ballot and whether people should do that right now if they can't tell if they actually had their ballot counted as a write-in.
Yeah, Jean.
Yeah, I mean, I look, I think if there's any question about that you did a mail-in ballot and you're not sure whether it got counted or whether it got in or lost in the mail, whatever, I think you should fill a provisional ballot out. The reason for the provisional ballot is that we want to make sure that somebody doesn't vote twice. So if you fill the provisional ballot out and we find out that your mail-in ballot did get received and did get counted, then the provisional ballot will be thrown out. But if you have any questions at all, I would encourage you to do the provisional ballot, and that way you're sure that you have a vote in and it will be counted. And again, we don't want to see, we want to make sure that somebody isn't voting twice. That's really important. And that's why we have the Board of Elections will review the provisional ballot and make sure that they're valid and that somebody hasn't voted twice.
Yeah. No, I think you two answered it well.
Okay. I know we're getting near the end of the hour, but we were late because I was having computer issues. So I just want to make sure we tackle two more things that are on here. Alex Miller asked if there are antibody tests available, meaning can we get tested to see if we already had it, but we're asymptomatic? You could call, I know, your primary care physician and see if they can arrange a test for you. Jean or Bob, any other ideas on that?
I mean, I think that's the best thing to do, to call your local physician and ask if they can give you a test.
And if that doesn't work for you, you can give the health department a call. That number is also on our website. And then there's a series of questions here that I am just going to block together because they're not really anything that we as commissioners can do about. I'm trying to just, so it's from Nick Disabella. He wanted to know if patients should receive, I think he means DUIs. Should patients still be able to have Second Amendment rights? Street value is cheaper than dispensaries. Shouldn't the prices be the opposite? And could we possibly see a countywide decriminalization ordinance? Yes, I guess people should still get DUIs if they are driving and they fail a test. Everybody should have Second Amendment rights in my value. No, not sure about that whole street value thing. And I don't think we'll be doing a decriminalization ordinance. I don't think we have that authority. Bob?
No, I agree with your comments. Yeah, I did see that. I did see there's another question on here I want to make sure we get to about ballots that have been cast already, but I'll let Commissioner DiGirolamo comment on the DUIs question.
The DUI question that Diane asked at the beginning, it's certainly if people are driving and they are impaired or intoxicated, they can certainly get a DUI under any circumstances. And I'm not sure about the decriminalization. Was that question related to maybe marijuana, Diane? Do you know?
No.
Yeah, as the county, we do not have the ability to pass a law to decriminalize the use of marijuana. That would have to be done at the state level for the whole state. And there is kind of like an issue growing up in Harrisburg with the issue of legalizing marijuana for recreational use here in Pennsylvania. I have never been in favor of that. I just think it's a terrible idea. I just think it sends a terrible message, especially to our children, to decriminalize marijuana. To allow legalized recreational use of marijuana. But I would be in favor of some form statewide of decriminalization of small amounts of marijuana. I think that makes all the sense in the world because I've seen too many times where people get caught with a small amount of marijuana and they end up with a misdemeanor and a felony, and it ends up on their permanent criminal record, and it really affects them for the rest of their life. So I think it would make all the sense in the world that if we decriminalize marijuana.
Bob, did you want to follow up on that? I think
no, I was looking at, there's a couple other questions about voting I saw that I wanted to make sure we got to before we ended.
Okay, do you have them right there? You can go ahead and
Yeah. I think I know we read the question by Jen Herring. I want to make sure that we kind of got that. I think her question was specific. If you asked for a mail-in ballot and you didn't get it, didn't come in the mail in time, we do have still today. We have the 3 ballot boxes, one at Quakertown office, one in the Levittown office, and the one here at Doylestown, where you can drop them off today. If you have your mail-in ballot, you don't want to put it in the mail today, but you have it, it's filled out, you can drop it off in those boxes. If you didn't get it in time and you're worried that you mailed it, but you mailed it too late, I know that the Board of Elections has gone to Common Pleas Court here across the street from our building to try and get those ballots that are postmarked by tomorrow counted. Now, a judge will have to decide that, but in the meantime, if you're concerned about your vote counting and want to make sure that your voice is heard, you can still go to your polling place if you feel safe doing that. It probably, based on the number of mail-in ballots we have sent out and received, I wouldn't expect there to be much of a crowd at any of the polling places tomorrow, if that's a concern for you. You can go and get a provisional ballot filled out. It will be marked in the book that you requested a mail-in ballot, so you will have to do a provisional ballot. They won't let you vote normally. And then, as Commissioner Marseglia said, what happens is that those 2 kind of things are rectified after Election Day, where they take a look and to see if, let's just say Ms. Herring was one of the people who did put in for mail-in ballot but didn't get it, but she goes to vote and does a provisional ballot. They want to make sure that, or let's say not that she didn't get it, let's say that she mailed it back, but she's not sure it's going to be received. The Board of Elections will take a look to see, did they receive a mail-in ballot from Ms. Herring? If they did not, then they're going to count the provisional ballot. If they did get one, then they won't count the provisional ballot. So that is the process. And then another sort of follow-up question, Mr. Howard Shargo asked about guarding the mail-in ballots that have been received already. The ballot boxes at the Quakertown and Levittown office are guarded by sheriff's deputies. All those ballots are collected. The Board of Elections has been guarding them. They really are no different than the absentee ballots that people have submitted for decades and decades and decades. It's the same process. Those ballots come into the administration building, which is always guarded, and they're put in the Board of Elections, which is even behind more lock and key. And everyone who's working there has to go through special training on how to guard those ballots and take care of it. I mean, keep in mind, these are our residents, the employees who work in the Board of Elections. They're neighbors, they're residents of Bucks County themselves who are working incredibly hard over the past few months to make sure we can carry this election off successfully.
So I think we have hit the end of the questions. I'll pass it back for some final comments. I would just like to clarify a couple things, got a couple pieces of information since we started. We are hoping, to be able to go to green. Someone asked when we thought before, and I think we're all hoping that it'll be maybe at the end of the month of June. But we also have to remember that there will always be some corona out there, probably for years until there's a vaccine. So not to forget that it's not going to be a zero and that we're going to have a little bit of it floating around. The other thing I wanted to add was that one of the reasons our count may be lower than the state's is because the state is counting positive antibody tests where we do not count them. So they count that, which our theory is that then you're counting somebody twice because you counted them with the COVID test and then you counted them with the antibody test. And I've also been told that if you want the IgG antibody test, you also could call LabCorp or Quest and see if they would do it without a prescription. I'm not sure that they will. And I'm going to pass it off to Bob as I throw in this last question that got in, and it's about are members of both parties present when they count the mail-in ballots?
Yes, I mean it's in fact the members of this board, the people who are on the board of elections are members of both parties. But just if we're wrapping up, thank everybody for all the questions they've submitted. We get them kind of in the order they come in, and we do have press conferences once a week as well. We'll see about we've been, these are really the first town halls that have ever been done, not even just over Zoom by the commissioners. We think they're worthwhile We'll continue to do these for, as long as we have information to share and these issues are going on. But thank you very much for your interest, and we're hoping that the information that we're giving you, you can give out to people so that they're getting, good sources of information and not ones that aren't as reliable. So thank you, and please stay safe.
Thanks. Final thoughts, Gene?
Yeah, just again, thanks everybody for joining. Thanks for the really good questions. I thought that they were terrific, and just encourage everybody to get out to vote tomorrow. I think that's really important as Americans. That's an important thing to do, and keep up the good work in fighting this coronavirus by wearing masks, washing your hands, practicing social distancing. I am really proud of the way people here in Bucks County have done this kind of work, and that's the way we're going to move from yellow to green, by keeping the numbers down and practicing all the safety issues that we've been doing. So thank you again.
Thanks, everybody. Wear your masks. Take care. We'll see you in 2 weeks.